I wanted to introduce our final speaker of the day, and that is Dr. Colt Blunt. Colt is actually a forensic psychologist and a long-term survivor. He's a 7-year gastric cancer survivor. He was treated with a full course of FLOT chemo and had a total gastrectomy in September of 2019. He has since been a mentor to stomach cancer patients and is on the board of directors of Debbie's Dream Foundation. Dr. Blunt is a forensic psychologist by trade and is the director of his state's forensic evaluation department. He has spent approximately 20 years evaluating patients and defendants at the request of the court, supervising trainees, steering policy changes, interfacing with external agencies, participating in internal review boards, and testifying as an expert witness. In his spare time, he is an avid tinkerer and has way too many hobbies. I met Colt a couple of years ago at a Debbie's Dream event, and I was immediately taken by what he was talking about and what he had gone through in his journey. And I asked him right then and there if he would speak at our next conference. So I'm so happy that he's here. Colt Blunt. Thank you.
So again, I'm Colt Blunt. I'm a stomach cancer survivor. My presentation, and kind of to contrast what we talked about earlier, is called Losing Myself. I was originally going to focus just on others, but I realized that part of this is I'm going to have to talk about myself and my experiences, my journey. I also want to say I know why I was stuck last, and that's because we had to, instead of saving the best for last, it's the most forgettable. So I understand that. In case we had to cut anything for time, it was going to be me. I get it, Teresa. So who I am, I'm a forensic psychologist. That's a fancy way of saying I don't help people for a living, unlike the psychiatrists that we saw earlier, even though we apparently kind of dress alike. I'm the type of psychologist that you don't want to have to meet with because you've committed a felony or accused of a felony if you're meeting with me. So there's that. I am a stomach cancer survivor. Specifically, I was diagnosed a little bit after Easter in 2019, and I'm going to talk a bit about my journey and experiences in a bit. I'm a patient mentor, I'm a patient advocate, and again, I am on the board of directors for Debbie's Dream Foundation. I want to talk about the experience of being a man in this world, not the world in general, but in the cancer world. But what I really want to focus on, and I want everybody to understand what this presentation isn't. It's not going to be a white American dude whining about how tough it is to be a guy. That's not it at all. I want to emphasize that I think our experience as a man can be a bit different. We are built different. Emotionally, we respond to things differently. We approach things differently. And that makes things a lot more difficult. I want to acknowledge really that there are a bunch of disparities in the cancer world. There is inadequate access to care for a lot of disparate populations. I'm not one of those. The problem with being a man ends up being a lot more of what's inside of us rather than the external world. So I had the opportunities. I had good health care. I had access to good treatment. That wasn't the issue at all, and that's not really the experience that men are struggling with. I was incredibly fortunate for a number of different reasons, like I mentioned already. And again, other people aren't as lucky. So I got to talk about the canned cheese incident. This is how I was diagnosed. But before I get to that, I need to provide a little bit of context about what was going on in my life at the time. So again, you've heard what I do for a living. I had just also recently found out that I could never be a father. And as a result of that, my marriage disintegrated. I separated several months before my eventual diagnosis. Spoiler alert, you already knew I was a stomach cancer survivor, so I'm not spoiling that part about it. And had just moved out for the first time in 14 years to live on my own. So I was in, quite frankly, a very garbage place in my life and didn't really care what was going to happen to me. And again, my diagnosis happened just around Easter of 2019, and this is a short story of it. I'm not especially close with my family. I had typically spent holidays with my wife's family for 14 years, and this was really my first holiday in which I didn't have anywhere to go. So I decided I was going to go and visit my father up in northern Minnesota, and we had this agreement that I was going to drive up after work. We were going to grab dinner together, and being my dad was in his mid-80s, he doesn't like to eat after about 5 o'clock, so me getting off of work at 5 o'clock and driving up there wasn't going to work, but he didn't want to tell me that. So he had dinner without me. I get up there, and I got nothing to eat. So he says, don't worry, I've got something in the pantry you can eat. He goes, he gets some crackers, and he gets, do you have those canned cheeses here? Like, it's like silly string, except it's vaguely cheese flavored. Yeah, so he pulls out one of those cans, plops it down on the counter. He's like, here's your dinner. Okay, I'm hungry. I haven't eaten anything for hours, so I figure it's better than nothing. And immediately I eat this and it tastes off, but I'm hungry, so I keep eating. And I even said to my dad, like, Dad, this doesn't taste right. And he said, oh, it's bacon flavored. It was dark. I couldn't read it, so I was like, I'm just going to take your word for it. I went through the entire can. I was full. I don't know that the can was full to begin with, but I finished it off. I will admit to that. And tossed it in the garbage. And again, this was the day before Easter, so I wake up in the morning, ready to go and see family, and I am violently ill. And I end up spending, not going to be graphic, but I spend the entire day in the bathroom. I don't leave, don't go and see family. And as soon as I'm able to actually get up and walk around, I go to the garbage. And again, this is 2019. I look at the expiration date on that cheese, 2016. So of course, my first thought is, you're an idiot, you gave yourself food poisoning. Of course you feel like garbage. And I felt sick for a number of days. It eventually got better, but never back to normal. So I'm thinking I've got this like lingering food poisoning. You know, just like bloating, didn't really want to hold anything down, just felt generally gross, wanted to sleep all the time. Week goes by, it doesn't get better though. There's still that low level of bloating, and then all of a sudden I started, again, for lack of better words, having these weird belching sessions, and it just didn't sound right. And it felt like something I had to do to like clear the air, otherwise that bloating would not go down. Now, thankfully, I already had a physical scheduled that year, and I have a fantastic doctor, which I am very fortunate for because I came from a line of awful doctors who would never listen to me. I switched systems, got this guy, and he was phenomenal. So I take notes, I go to my physical, and I say, hey, doc, I've got this whole page of notes of things I've been experiencing for the past week, and I'm wondering what you think. And he said, you know, it's probably just acid reflux, pretty common for people starting out at your age, but I want to take it seriously because you don't complain about things unless there's something going on. So he says, I'm going to put you on a proton pump inhibitor for 10 days. After those 10 days, if you are not perfectly back to normal, I'm sending you for an endoscopy immediately. Week goes by, he contacts me. He even contacted me a few days early, and he asked me, Colt, do you feel better? And I said, you know, maybe a little bit, but certainly not back to normal. 3 days later, I'm going in for an endoscopy. Now, we heard earlier about great endoscopies and great equipment that we have in the US. Well, because my doc wanted to get me in so quick, he went with the first person available, which was literally a dude in a trailer who I don't even know if he had a medical degree when it comes down to it. But I go to this trailer, sketchy I know, and I get scoped, and it was fun. You know, we talked earlier about how sometimes you're completely out, sometimes it's twilight sedation. They just numbed me and that was it. So I just had to relax and kind of let it happen, which was fun. And the GI doc, of course, sticks a scope down, does a really quick scan because he doesn't expect to find anything, finds an ulcer. He says he's not surprised about that. And I asked the question, what is the chance that this is cancer? And he said 1 in a million. And I asked, why would you say 1 in a million? And he said, well, I just diagnosed another 37-year-old last week with stomach cancer, and there's no way I'm going to diagnose a second one a week later. So that's what I go home to. Next morning, I wake up, even before my alarm is supposed to go off, to that doc. And he says, yeah, it's stomach cancer. And then he tells me stomach cancer is not really a big deal. He doesn't have time to talk to me, and that's click. That's it. I had like maybe a minute with him. And then, of course, I turned to my real doctor and then Dr. Google to figure things out. I already knew that stomach cancer was serious. I have a family history of GI cancers. Mine is not at all related, though, for whatever reason. And I knew that if I was going to get through this, they were going to cut my stomach out, and that was a good thing. That's what my end goal was going to be. Thankfully, my personal doc was able to get back to me pretty quick, was able to put the rush on things, and then I got to start calling friends and family and telling them what I was diagnosed with. And I probably sounded like a robot because my response to everybody was, hey, just wanted to let you know I got diagnosed with stomach cancer, and if everything goes well, they're going to cut out my stomach. Real enthusiasm there. But I got to be very, very fortunate, so I'm going to flip through here. And I want to say I've got a PowerPoint, not because it's going to benefit you, it's going to keep me on track a bit, because as you can tell, I can just talk and talk and talk. So aside from my doctor being really, really good and making sure that he got a rush on me getting the scans I needed, blood work, all of those things before I ever met with an oncologist, I also felt it was really important to self-advocate. So I got on the phone with, I'm not going to name names here, but there's a very prominent clinic that's named after a condiment, if you want to think about it that way, in my state. So I got a second opinion right away from them, and I said, get me in as soon as possible. I will take any cancellation. I will show up on no notice, even if I have to no call, no show at work. I'm going to be there. And they were able to get me in a couple days later. So very fortunate there. In the meanwhile, I'm meeting with my oncologist. They don't quite know what staging is. They were hoping it was early stage, but they need to send me in for an endoscopic ultrasound at that point. I get the endoscopic ultrasound right before I go to that second appointment, and they tell me, hey, even though we thought that this was earlier stage, it's actually later stage. Thankfully, we don't think it's metastatic, but you never know. I end up going to my second opinion. I'm thinking very positively at this point. I'm young. I want them to throw the kitchen sink at me. I want them to do everything that they're going to do, and I am stubborn, I'm headstrong, and I'm just going to get through this through sheer tyranny of will. And then I go to that second opinion appointment, and the surgeon says, you have no better chance than an 80-year-old man. I'm not going to treat you any differently. I think that likely you aren't going to make it to surgery, and even if you do make it to surgery, I'm likely going to cut you open. We're going to find out that it is metastatic. I'm going to close you up. You're going to go home, and you're going to die. And that's all there is to it. And if it is a successful surgery, it's probably going to come back, and if it comes back, it's going to kill you. So I go in confident, going to make it through, and then I'm completely deflated at that point. I'm pretty much resigned to what the result is going to be. Thankfully, I then meet the surgeon that I was originally supposed to meet with through my primary clinic, and he has more experience, he's very much more confident, and he didn't BS me in any way, but he said, I'm going to do everything I can to make sure that you're going to get to that surgery, and that when you are done with that surgery, I'm going to get everything out of you. I'm going to give you the best chance I can. So I decided to go with him instead of this really prominent clinic that everybody in my family and friends group wanted me to go to. So that is kind of the basic story. And I'm going to get through a few other pieces here. I want to emphasize that I didn't have a bunch of supports in my own personal life at the time. Again, going through a separation was tough. I had lost friends through that. My family wasn't super close with me, so they weren't a good support. So I did what every sane person does, and I went to Reddit, and I searched for people who had posted about stomach cancer years in the past, and were continuing to post about things that were not cancer-related. And I found one person who I thought was going to be a good match. I contacted him, and he responded pretty much immediately, said, you know, I'm not really a part of this community. I don't like being a part of it. That's a time in my life that's over. I've never really been a part of it, but I'm going to walk you through it. And that was my buddy, Mike. Mike and I are friends to this day. He is about 10 years out at this point, and he was a fantastic support. Now, I also then reached out to people on Facebook, and they happen to be a lot of people who were associated with Debbie's Dream Foundation. And they were great supports as well, and also continue to be fantastic friends. And I was incredibly lucky. One thing about me is I went through flot chemo, and I had, again, those symptoms that I already talked about. And after the first round, I felt perfect. 100% perfect, no symptoms, everything gone, everything was resolved. And I said to my oncologist, Dr. Jha, I think it's taken care of things already. And he looked at me, he's like, yeah, sure it did. Like, it was one round of chemo, there's no way. And he said, maybe after 2 or 3 rounds, if you're still feeling this way, we will consider that as a possibility. It's probably just the steroids making you feel better. But for an entire week, I felt great. And when I showed up to my next chemo appointment, I meet with Dr. Jha, and he says, you know what? Maybe you're gonna be fine. Maybe you're gonna just breeze through this. The side effects of chemo seem to be not too bad for you. And I was like, that's great. I'd love to be able to keep my hair and keep my beard. And probably an hour after that chemo session, hair's falling out in clumps. So that's not how that turned out either. And again, I just had great treatment providers. My surgery was a complete success. I ended up having a pathological complete response to chemo, which they found out after round 3, and there was basically nothing left in me by the time they cut out my entire stomach, stitched me back together. So I was very fortunate there. So they say that you often lose weight when you get diagnosed with cancer, or sorry, that you lose weight as a result of stomach cancer. So this is a picture of me before cancer. Except actually it's not. That's a picture of me a few days after I was diagnosed. I was in the best shape of my life. I have to kind of convert things now because I'm a dumb American here. So I was about 105 kilos in that picture. And I'm going to give you some progression here. This is when I lost my hair. I had not lost any weight at that point. I actually gained a little bit of weight on the way to my surgery. This is me at about 100 kilos, so I lost a little bit of weight. This is after my surgery. And then I went home and I ended up starting chemo back up again. And you can see I start losing some weight. This is me at 65 kilos. I don't know what I weighed there because when I got to 65, I didn't want to know anymore. So I want to frame this too. I really liked where I was. I liked the body that I had. I worked really, really hard for it, and then I lost it all. Another thing that really bothered me is the platitudes that I would experience from people. I would have people in my life who would say, I really like your new body better. I don't care what you think. It was really tough to hear. And then people would say, I'm so jealous of you. You can eat whatever you want and you'll never get fat. I can't eat whatever I want. I can't eat most of the things I want. They make me throw up. I get sick all the time. It's awful. You don't want this. Don't say this to me. But these are things that people would tell me. And I knew that I would never get the body back that I had. It was just impossible, and I had to wrap my head around that. And combined with the fact that I knew I was never going to have a family, I don't look like the man I used to look like, I felt like less of a man, and it sucked. And so hearing these platitudes from people just kind of, it drove the knife in a little bit further. I felt like I was just kind of broken and irreparable at that point. And I'd love to sit here today and say I'm a completely remade, perfectly healthy person, but it's not true. These are things that we carry with us forever. And I think that, man or woman, we all have unique experiences, and certainly I think being a man is a little bit different when it comes to muscle and that physical condition that sometimes men think are part of what it means to be masculine. Now, I want to shift towards the end here to being a man in the advocacy realm, because I have advocated for, I have mentored a ton of people over the years, and probably 95% of them are women. Now, I have had a bunch of men referred to me by their spouses, significant others, whatever it happens to be. And I usually get an email, a message, whatever it happens to be. I don't know if I just keep hitting buttons here or what. What is going on? All right. Well, you just listen to my voice. I'm sure it's soothing right now. So I get all these referrals, usually from the significant other, and I will reach out to the patient, the man, and it's crickets. I never get responses back. And to this day, the men that I have connected with are just a handful. Unfortunately, one of them was somebody I met very early on who happened to be kind of like me in that he was willing to ask for and accept help. And we kind of hitched ourselves together, and we were going to get through this together. And right in the middle of treatment, he ended up having a really, really bad turn, and he was just gone overnight. So that was the person I hitched myself to, the only other man I knew going through this, and then he was gone. And I ended up meeting some really good male role models throughout, but they're, again, just a few of them. And as far as patients who I've met since, who I've mentored, it's just a couple. Again, I've been referred a ton of them, but they just don't reach out. They don't process their emotions. They don't process their experiences. They don't reach out for help. We don't self-advocate. Now, like I said, I was on the horn immediately trying to get second opinions, trying to get earlier appointments. The men that I have met typically are getting diagnosed later stage than me because they put it off until the very end. They put it off until it's too late. They put it off until, quite frankly, they're going to the ER because they're throwing up or defecating blood. I never got to that point. Again, we don't reach out for support, and even worse, when we are offered support, when people try to set us up with support, we ignore it. We don't accept it. And because of that, we don't have some of those resources that thankfully I was able to have. They don't know what questions to ask. They don't know where to go. Often when I get a mentee, I'm connecting them with a doctor in their area or a specialist, or if they've got a unique condition, I'm reaching out to one of my connections to try to get them in for a second opinion. Now, if you don't accept help, you're not going to get those resources, and it's just the unfortunate truth of it. And again, we don't accept that help when it's offered. This leads to worse outcomes. So that is why I firmly believe that men are diagnosed at a later stage, and they don't have the same treatment outcomes that women often do. That is my quick and dirty presentation, not only about myself, and I feel like I talk too long about myself, but also men and why we can suck. Thank you.
Thank you so much. Man, that was a good presentation. I think a couple of people will have some questions for you.